Good evening. I'm Dr. Kester. In this presentation, I want us to briefly look at amniotic sheaths, amniotic bands, and circumvallate placenta. It's an ultrasound case presentation. A 30-year-old woman in her second ongoing pregnancy, gravida 2-1, presented for a routine anomaly scan at 20 weeks GA. Sonographic examination of the fetal central nervous system, gastrointestinal system, cardiac and musculoskeletal systems showed no obvious abnormalities. However, when I examined the placenta, it was posteriorly sited, but the inferior part of it was stepping off the uterine wall onto a membrane, as you see in this sonogram. So, on further examination, I saw this membrane running across the uterine cavity, dividing the cavity into a superior and inferior cavity. The fetal parts could move between the two cavities. The membrane itself is multi-layered and echogenic, in keeping with amniotic sheaths. So, what are amniotic sheaths? Amniotic sheaths are benign intrauterine membranes formed when the amniotic sac grows over pre-existing uterine scar tissue. Okay, so as you're aware, the membrane is composed of the chorion and the amnion. Now, when there is a scar tissue, they grow over it, as seen in this schematic diagram. On this right side, we can see this adhesion. The amnion and the chorion grow around it, making it a 4-layer structure, which is this amniotic sheath, and divides the amniotic cavity into the superior part where the baby is and the inferior parts in the inferior compartment. Now, this is different from the amniotic band. Seen on this schematic diagram on the right, the amniotic band is a membrane that arises from the amnion. It's a thin membrane that arises from the amnion. The risk with amniotic band is that it can tie to the baby's legs, to the baby's hands, to the baby's abdomen. It can amputate a child. It can cause so much damage. And that's part of why this presentation is very important. Now, what do they look like on ultrasound? Amniotic sheaths appear on ultrasound as thick membranous sheaths attached to the uterine wall, as you can see on this image, on this sonogram. So they are multi-layered and thick. Now, although amniotic sheaths have not been associated with fetal anomalies, growing evidence suggests that amniotic sheaths are linked with an increased risk of fetal malpresentation, cesarean delivery, preterm birth, low birth weight, and neonatal intensive care unit admission. And in cases where there is a placental extension, like in the one I saw that is presented on this slide, where the placenta grows onto it, blood vessels may be exposed. Therefore, the risk of bleeding is also present in amniotic sheaths. Routine prenatal ultrasonography can identify various intrauterine membranes, including amniotic sheaths, amniotic bands, circumvallate placenta. Early differentiation of these intrauterine findings is critical to guiding prenatal counseling and surveillance, as each entity is linked with varying fetal and obstetric profile. Okay, now on ultrasound, this is what a circumvallate placenta would look like. A circumvallate placenta is where the amnion and chorion fold on each other at the edges of the placenta. So they now start to approach the middle of the placenta, creating this membrane. So they may appear either way as you see them on this slide. So the risk of this is that there is a higher risk of abruptio placenta, there is a higher risk of bleeding in these patients. So it's important that we identify this. Now, amniotic bands. This slide shows a schematic diagram of amniotic bands. As I said earlier, they arise from the amnion. They are thin membranes and can tie to the fetal arms and legs and even abdomen. So it's very risky as they can amputate the child and they can cause various damage and are usually associated with other fetal abnormalities. On the right, we see the sonographic image. The arrow points to an amniotic band. Unlike the amniotic sheet, amniotic bands are thin and echogenic. So it is important that we identify these membranes early and differentiate them to enable proper surveillance and treatment. In conclusion, amniotic sheets are generally benign remnants of uterine synechia and do not restrict fetal movement or cause deformities. Amniotic bands represent a true obstetric emergency due to the risk of fetal entanglement, constrictions, and limb amputations. Now, circumvallate placenta is a high-risk morphology and is a significant independent risk factor for placenta abruption, up to a 13-fold increase in risk. So, persistent vaginal bleeding and premature rupture of membranes. Early and accurate identification is critical to ensure high-risk pregnancies receive appropriate surveillance. So, what do we do? What's the clinical management strategy? Confirmed cases of circumvallate placenta or amniotic bands require serial growth monitoring and assessment for signs of abruption and of restricted fetal growth, so that the appropriate specialists, fetal maternal specialists, can do the needful to preserve the pregnancy. And then in situations where harm has already been done, amputation has occurred, or complications set in, immediate postnatal management can be instituted. Thank you.